Hi, this is Dr. Jaime Daniel, and welcome to my podcast. Today I want to share with you about hives, but the medical term for hives is urticaria. Pay attention, it is important to know that both are talking about the same thing. Hives are raised or puffy areas of the skin that itch intensely. Hives are a very common condition. About 20% of people have hives at some time during their lives. Hives develop when there is a reaction that activates immune cells in the skin, called mast cells. When activated, these cells release natural chemicals. One important chemical is histamine, which causes itching, redness, and swelling of the skin in an area, a hive. In most cases, hives appear suddenly and disappear within several hours. Hives usually respond well to treatment, which includes medicines and avoiding whatever triggered the hives. Hives are raised areas that itch intensely. Hives might look reddish in color or light-colored skin. The color changes can be hard to see on darker skin. In some cases, the raised areas enlarge and merge together. Itching is usually the most bothersome symptom of hives, and it may be severe enough to interfere with work and sleep. Severe pain, blood blister-like spots, and bruising of skin are not typical of hives. Having hives along with a fever and joint pains is also not typical. These symptoms suggest a different condition called urticaria vasculitis, which requires a different treatment. In up to one half of people with hives, a condition called angioedema also develops. Angioedema is similar to hives but occurs in the deeper layers of skin. Hives and angioedema can occur at the same time, doing symptoms like puffiness of the face, eyelids, ears, mouth, hands, feet, and genitalia. Also, swelling that usually affects one side of the body or affects one side more than the other. A sensation of fullness of discomfort in the area of swelling, slight redness of skin. Also, the skin may also be normal in color. Hives can also occur as part of a more serious allergic reaction. You should see a doctor if you do some of these symptoms: trouble breathing, tightness in the throat, nausea or vomiting, cramping abdominal pain, passing out. Hives are classified based upon how long you have the hives. Hives can be acute, chronic, inducible. When you first get hives, you cannot tell how long they will last, and so you cannot tell if you have acute or chronic hives. Also, all types of hives look similar. They often have different triggers. Learning what triggers your hives can help you to avoid triggers. Most cases of hives are acute and will not last beyond a few days to 1 week or two. Triggers of acute hive can include infections, even a common cold, drugs like the non-steroidal anti-inflammatory, insect stings, and if you get hives all over your body after an insect sting, This may be a sign for a more serious reaction called anaphylaxis. Anaphylaxis must be treated as soon as possible. Food allergy can cause acute hives in some people. Food-associated hives typically appears within 30 minutes of eating the food. The foods most likely to cause hives in children include milk, eggs, peanuts, other nuts, soy, and wheat. The foods most likely to cause hives in adults include fish, shellfish, peanuts, and other nuts. Hives can occur after you touch certain substances if you are allergic to them. For example, children who are allergic to dogs may get hives if a dog licks them. Other things that can cause hives include plants, raw fruit and vegetables, and latex. Chronic hives occur daily or almost daily and last longer than 6 weeks, sometimes for years. Chronic hives can be frustrating because they come and go and can interfere with sleep, work, or school. Hives affect how you look, and people may worry about being near you for fear that you have a contagious infection. However, it is important to remember hives are not contagious. Chronic hives are rarely permanent. Almost 50% of people are hive-free within 1 year. Chronic hives are rarely caused by allergies and are not life-threatening. The bothersome symptoms of chronic hives are treatable in most people. In most cases of chronic hives, the cause is unknown, but the researchers suspect that problems in the immune system may play an important role. Hives can be a sign of several other medical or autoimmune conditions, including thyroid or liver diseases, chronic infections, or lupus. Most people with one of these conditions will have other symptoms apart from the hives. Hives can be triggered by a variety of physical factors, for example, exposure to cold, changes in body temperature or sweating, vibrations, pressure, exercise, sunlight, or water, though this is very rare. There are also things that do not usually cause hives in swelling but can make them harder to control. These include over-the-counter medication used to treat pain and fever, and any kind of opioid medication. Acetaminophen does not worsen hives or swelling, so this can be used to treat pain and fever instead. Other factors include alcohol, stress, sleep deprivation, and for people who menstruate monthly periods. Finally, there is a common condition called dermographism, literally skin writing. People with this condition develop reddened, raised lines if the skin is stroked firmly or scratched. Inducible highs tend to be long-lasting and are considered a type of chronic highs. Most people with hives do not need any testing. The diagnosis is usually based on their symptoms and a physical examination. However, tests may be recommended if hives do not resolve within 6 weeks. Skin testing for food and drug sensitivities may be recommended if there are concerns about allergies as a cause of symptoms. This is usually done for people with acute hives. Chronic hives are rarely caused by an allergy. Blood tests are sometimes done if hives continue for 6 weeks or longer. Blood tests can tell if there are signs of underlying diseases, such as a thyroid problems or an autoimmune disease. A skin biopsy may help identify uncommon causes of hives. A skin biopsy may be recommended for people who have chronic hives along with other symptoms, such as a persistent fever, painful hives, individual hives that last for days at a time, or hives associated with bruising of the skin. A skin biopsy may also be recommended for people who have other symptoms or abnormal blood tests. Hives are treated with a combination of avoiding things that cause or worsen the hives, plus the use of medication. The first thing for hives is to figure out what is triggering your hives and then avoid that trigger. Even if you cannot figure out the trigger, hives usually disappear over days or weeks. Antihistamines are medicines that can relieve itching. Most people with hives respond to antihistamines. You may need a relatively high dose to control your symptoms. There are different types of antihistamines. They differ in side effects, cost, how long the medicine lasts, and need for a prescription. So we have non-sedative antihistamines, the older antihistamines, and other type of antihistamines. They are usually used to treat heartburn, and the very sedating antihistamines. They are often recommended to be used for bedtime to avoid any accident that you could get in your work or in other activities that require attention. A high dose of antihistamines is usually recommended before trying other treatments. However, oral steroids can help to relieve severe acute hives that do not get better with antihistamines. Once the hives have improved, the steroid dose is gradually lowered and then stopped. Oral steroids may be used temporarily to relieve chronic hives, but they should not be used for long-term treatment. This is because steroids can have serious side effects when taken for long periods of time. If you are taking oral steroids for more than 1 month per year to control your hives, you should see a specialist. If your hives do not get better with the treatments proposed previously, you should look for an allergist or a dermatologist. In case you are pregnant or planning to try to get pregnant, talk with your healthcare provider about the medications you should take or some other ways to get relief from the hives and keep safe your baby. Thank you.